Hi everyone, this is Ricky Spencer, and welcome to another episode of Quest by Community Our Health Matters. Today we're going to be looking at the impact of health research and how does it fit when it comes to understanding the resources that we have in the community, who gets what, and how we can use research to help us understand health equity in Australia. We have two leading researchers with us today to kind of unpack some of their research that they're undertaking. And we're also hear some of the highlights from some very important research that they're undertaking that impacts our LGBTIQ plus community and our First Nations communities across Australia. It's an honour to have Dr. James Fowler, who is a research fellow at the University of Queensland and the University of Southern Queensland. Their work focuses on promoting the well-being and sexual and reproductive health of underserviced populations through the development of health promotion initiatives and models of care to improve health services. James' work is underpinned by the principles of community-based participatory research and mixed methodologies. So we'll unpack that. And we also have with us today Sarah Warzywoda, and I hope I pronounced that correct, is a research associate at the Kirby Institute's HIV epidemiology and prevention program, working on implementation and evaluation of new PrEP innovations for priority populations in New South Wales. She is in her final stages for completing her PhD, which focuses on access and uptake of pre-exposure prophylaxis for HIV prevention in young people. After using all those complicated words, welcome to our show. And I'll start by you, Sarah, if I may. Tell us a little bit about your personal journey. What motivated you to pursue a career in health research?
Thank you for having me today. I undertook my master's in public health back in 2017, I think it was. And sort of towards the end of that, I embarked on a research project as part of it. And it was around access to pre exposure prophylaxis for HIV prevention. And following on from that, I then moved overseas for a while. And when I came back, it was sort of the start of COVID. And the whole time I was gone, I was kind of interested in continuing down that research path and, continuing down sexual health and HIV research. So, at the peak of the epidemic, there wasn't a lot going on. So I thought I would kind of see what I could do in terms of, starting a PhD and following that research journey. And that kind of led me to here.
Now it's over to Dr. James Fowler.
It's so lovely to spend time with you, Ricky. I think my journey in research started off when I was young and my mum acquired a traumatic brain injury. And through that journey, I kind of realized how fragile and how important health is. And it instilled in me the seed that's kind of been nurtured over the past kind of 20 years of my life with amazing mentors, with community connections. It's really shown the importance of health and the ways that we can work together to actually build stronger communities through health. And that kind of came to fruition for me about 5 years ago, getting a kind of an official position in research and starting as a research assistant, and then starting a PhD, which I finished, formally like 20 days ago. So it's been a long journey into health research, but it's absolutely my favorite place in the world to be.
So, James, I know we've spoken before and you've done quite a lot of research also within the LGBTIQ community recently, and now you're doing quite a lot of work in the First Nations space around Australia. Do you want to just highlight some of the key findings from any of your current research? And
Mm-hmm.
perhaps for the people listening, the unique health disparities faced by uh, certain populations.
I think the biggest things I've learned from my findings so far is that whilst we have this beautiful banner of LGBTQA plus or whatever kind of acronym works, each individual has their own unique experience with identity. And because we all live in our own different kind of social structures, no one person has the same experience. And so I think in the area of health research, it's really important to be mindful that whilst we're targeting or thinking about a broader LGBTQIA plus community, we can't lose sight of the individual within it, and we can't lose sight of the different factors that shape that person's experience. So one of my projects that I'm really proud to be a part of is the Blak and Proud project based at the University of Queensland's Poche Centre for Indigenous Health. And that's focused on understanding the healthcare experiences of Aboriginal and Torres Strait Islander LGBTQIA plus people. And what I love about, being on this journey of research with community through that project is that we see the ways that two intersecting identities come together to form unique healthcare experiences, but also unique needs when it comes to addressing inequities in health systems and what we can do to build better models of care to promote health. But I'm really excited to be able to explore that in other areas and other communities. I think what's special about the type of work that I'm again, I use the word privileged a lot, but I am to do, is that it's community based. And a lot of it is then having communities tell me as a researcher, these are our issues and this is what we want to address. And then we start a journey together on addressing it.
Over to you, Sarah. I want to ask some questions in relation to your research around what is PrEP, the uses of PrEP, and the focus with young people, so that our audience can understand why do we need to look at the factors that impact young people accessing PrEP.
PrEP, or pre-exposure prophylaxis, is a medication that you can take to prevent HIV if you're at higher risk. And there's different ways you can take it. You can take it daily, or you can take it on demand, which is driven around sexual encounters. And there are a couple of new modalities that are in the works, and that will hopefully be available too, such as like a long-acting injection or implant. And the reason that my research focuses on young people specifically and their needs is, when we look at HIV notifications globally, young people are disproportionately burdened by HIV around the world. And in Australia, HIV is a notifiable condition, which means we monitor diagnoses and notifications. And when we look at notification data in Australia over the last decade, young people have maintained low notification rates or diagnoses. But what we see is when we look at the next age group up, when young people enter their early 20s, there is this huge increase in notifications. And in 2022, that was about 16 times higher, which is the biggest increase between age groups that we see across this data. And this has been consistent over the last decade. So what that did was prompt us to have a look at what is happening with young people so we can help mitigate that trajectory of risk that we're seeing. And from research that we've sort of done, globally, and as well as the research that I've done, there are some factors that impact young people differently to adults, such as things like stigma, parental consent, and access, financial limitations. So we needed to understand what those impacts were in the Australian context to ensure that young people had equitable access to HIV pre-exposure prophylaxis when they needed it.
When we think about, we get a lot of messages out there in the community that HIV now is almost preventable. What sort of, I guess, surprising results have you found about in relation to young people's experiences of taking PrEP? Are there any misconceptions that you found were notable in your research?
Yeah. So you are right in that HIV now, it's considered among young people that we spoke to largely a sort of disease of the past. It's not really,
Mm.
in the periphery for young people today. There's no threat of HIV or concern around it as there was, that we've seen in previous decades. So young people today don't really have the same level of awareness or concern around HIV, and it's considered a chronic manageable condition today. Some of the misconceptions that we sort of found when speaking with young people was around how accessing PrEP, there's still a lot of stigma associated with accessing PrEP for some young people, around that's attached to slut shaming. So while PrEP is described as a proactive health choice and it's, beneficial for the individual and for the broader community, there is also this sort of association with, well, if you're taking PrEP, you must be at higher risk in having a high number of sexual partners. So there's this stigma that's sort of attached to, if you're taking PrEP, I don't know if I want, to engage with that partner because they deem themselves at higher risk.
Mm.
As well as, I guess, a lack of awareness and knowledge among young people around not only the existence of PrEP, but also how to access services and sexual health services specifically. So there is a limitation in the linkage to care for young people. Some young people described not understanding what their confidentiality was around their Medicare and needing a referral to access sexual health services. So there is a limited understanding of not only the risks and things like PrEP and STIs and HIV among young people, but also how to access services if they do want to sort of explore what their options are.
Now, James, over to you. I want to ask you a little bit about your work that you're doing with Indigenous communities. One of the questions that we get asked quite a lot is around the notion of data sovereignty. How will you collect and store information, and privacy, and what you will do with that information once you've collected it?
For the projects that we're working on together, specifically the Blak and Proud project, one of the ways that we kind of manage this really important concept is by having community reference group who kind of have governance over the project and guide lots of our decision making around the way data will be used, the interpretations of the data. We also make sure that in all the projects that we have, it's led by First Nations researchers. And through that lens as well, we get to have some really clear leadership over how data is stored, the way that we use the data. But I think as well, making sure that future access to data is done in a really considered way as well. And one way that we make that very clear in our information forms is by being very transparent about whether or not any information that you have provided us in this research will be used in any kind of future research, and if so, in what context. And quite often we don't allow that. The information that you've provided is only for the very specific guys that you've kind of provided informed consent to. Sometimes if we have a big broader project, we might describe it as it's related to other research talking about models of care or health systems. But I think ultimately the most important thing, and especially from my own perspective as a non-Indigenous researcher, is that all this stuff is guided by First Nations leadership, and First Nations peoples have real active control as part of the research process.
If people were sort of involved in your research that you're undertaking at the moment in Queensland, in terms of privacy, how will you capture that information to ensure that people's identities are protected?
So thinking about kind of the projects we're launching very soon, which will involve a series of yarns with myself and another researcher. Privacy is protected in a number of ways. So firstly, all information that we have is stored in a really robust kind of IT managed system that I couldn't even begin to explain how it works, but we're told that it's very, very secure. That means that the research data itself can't be accessed by people who aren't approved by an ethics review board, but also meaning that foreign influence, hackers, those types of buzzwords. The data is kept very, very safe. When it comes to actually using the information as well, we make sure that we remove mention of any names. We make sure that there's kind of identifiable information that isn't a name per se. Say if someone's describing a town they live in that might be a small community, or if they're describing a health service specifically, we make sure that they're removed as well. There is always in research, a particular type of research that we do that asks people to share really, really vulnerable stories, that there will always be a degree of risk involved with talking about that, because no matter how much we can do, there'll always be, that disclosing of your identity. And a big part of what we do is making sure that people understand the contingencies that we have around protecting it, and making sure that that person is okay with having that story shared, and that whilst we will do our absolute best to make sure that data is protected, if someone does a solo interview with us as well, they get the chance to read their transcripts and erase things. But once your story's out there, and there's a beautiful, beautiful elder who described this to me once as once the story's out there, it's in the wind. And so we do our absolute best to make sure that the data is protected and making sure that the person understands that the story is out there, it's in the wind, and to make sure that when they're providing their consent, they have that comfort with that.
Question to both of you. So I'll probably perhaps whoever wants to jump in first. And this is around my work that I'm doing on the concept of disclosure, the impact disclosure has on the participants' life journey, their sense of self, giving to others, and another concept, aftercare, when people participate. Sarah, do you want to talk about, in your area is especially sensitive because it talks about people's sexual behaviour, and as you mentioned before, labelling that, to someone, to a young person, to disclose that they're on taking PrEP. What sort of mechanisms do you put in place to ensure with your participants that any disclosure, that they're supported through telling their story?
So when we spoke to young people, we offered them all of the information prior to participation that sort of outlined what their participation involved, how we were going to use the data, how it was going to be stored. And then we gave them the opportunity to sort of ask any questions prior to the interview to make sure that they felt comfortable. At any point, we sort of said, if you're not comfortable, we can stop, or we can pause the interview. So we were very much guided by what the young person was willing to share with us. Some were taking PrEP and some weren't. So we kind of, crafted the conversation around their experiences and just made sure that they felt comfortable if we needed to have a break, if they shared something that we felt was quite personal. We, just made sure they were feeling comfortable in the moment. After the interview, we then, continued the conversation around how we were going to make sure their data was de-identified and stored, and, again, offered them the opportunity to ask any questions around that. And we then sent a follow-up email, which sort of had a whole bunch of services and like links that they could then access if they felt like they wanted to have any more conversations with community organisations or additional support outside of us. But they were also welcome to contact us at any point if they wanted to continue the conversation or if they felt like they needed extra additional support.
James, what about with your work and disclosures?
Yeah, I think Sarah and I, we use very similar mechanisms in terms of supporting people depending on what they disclose. We always start it before we do any research together. And what I mean by that is when we have our initial conversations around what will the project be, the consenting process with an individual to make sure that there is that support from the very, very beginning, because we never know what could be triggering for someone, or even just reading something about, say, if it's LGBTQIA plus research, that even just reading a poster about it is in some way starting a process of disclosure. So we try to make sure that we embed that really, really early on. And as Sarah was describing with her research, building that all the way through into kind of the research itself and then beyond with the checking in process. And part of our role with the community reference group will be making sure that whatever types of supports that we offer, they'll be culturally appropriate. In the same way that if it's a broader LGBTQIA plus project, we'd make sure that the resources we provide are queer affirming. And it's so important that we do that because we know that not all, say if we're using the context of like a mental health support line, we know that these general services can be really helpful for some people, but many aren't comfortable accessing that type of, more broad level stuff. So that's why we make sure that we're guided by including things like 1-3 Yarn or Q Life into these types of projects, so people have those targeted supports to be able to facilitate disclosure. I think the other important thing that Sarah touched on it, is that we always want to remind individuals in research that they have full autonomy over everything they share. And that means that if they don't want to disclose, they need to feel safe enough. be able to turn around to us as researchers and say, no, thank you, I don't want to share that information with you. And so that's part of our process of consenting, is to make sure this individual knows that whilst there is this horrible inherent power dynamic that we have in research that hopefully we can work to address, but it's there and it's quite systemic, that they have that autonomy over what they do and don't disclose.
Intersectional identities, because we keep hearing that word bandied around a lot by politicians, all around the media, and sometimes people say it's sort of like a woke term that's sort of that people just throw in. But how important is intersectional identities? And for those that aren't aware, we're talking about things such as race, gender, socioeconomic status, play in your work that both of you have done in health research? Like, why do we look at intersectional identities?
In the research that I've done, it is very important in terms of how people engage with awareness, knowledge, and access to services. So while people might be identifying with a certain sexuality, their cultural influences may be a limitation to accessing care. It may be that back in their home countries, there was limited services. There's a lot more stigma around certain sexual identities or accessing HIV prevention. So when coming to Australia, those beliefs and those limitations can really impact a person's individual ability to then access these services, or even their beliefs around the efficacy of PrEP and whether or not it actually works, or all of those influences act in Australia. And when people are involved in their cultural communities as well, it can impact their ability to share their identity. So it can really sort of underpin somebody's ability to access or share information about themselves with the people that are close to them, and impact their beliefs around accessing healthcare and things like PrEP. I was going to add, I think it's really important for us to consider all of these aspects that make up an individual's lives, and all of how these different, identities that an individual sort of has can really impact how they sort of, day to day can access services or have these conversations with the people around them.
And James, would you like to add anything to that?
Sarah answered that quite brilliantly, and I would hate to undo the eloquent answer that she had with my rambling.
Something that I spoke with one of my previous guests, Dr. Karina Saxby, health economist, about the impact of Trump and his policy about defunding any research that is to do with trans and gender diverse populations in the US. And we spoke on there about the impact global research, then has in Australia. From either of you want to sort of comment to say, why do we need to be concerned when we look at things such as when, say, the US or any country decides to disregard a population that's marginalized and defund that research? So why is research important in looking at marginalized groups?
Number one, I think it's incredibly concerning because as a broader government, it's there to support all citizens. And as we know, there's estimations and numbers aren't great because we're very bad at measuring this properly. But we know that trans and gender diverse individuals make up a really important proportion of Australian society, and I'm sure in American societies as well. So number one, it's concerning because it's a very intentional act of prejudice against people. It's really concerning for me in the context of trans health research, because often what is banded around is that there isn't enough evidence of this, evidence of that. One thing I know from my research in gender affirming hormone therapy is that accessing, for the people I've worked with, feminizing hormone therapy is one piece of a larger puzzle. And so we need good longitudinal research to tell us how is this all shaped, because accessing hormones doesn't address, for some people it's gender dysphoria, it doesn't address families who are not supportive, it doesn't address fear of being out in public. So people look to studies that, look at one aspect and then say, well, that didn't show enough, so therefore it means hormones aren't working. But it's because society isn't built to support trans and gender diverse people. So removing funding for a whole community means that we're going to not be able to get this longitudinal data. We're not going to get the evidence that we need. And it creates this weird catch-22 when people in high offices are saying, well, we need more evidence, but then the funding for the evidence is cut, so we can't produce the evidence, and it creates this really horrible cycle. And I think we need to be concerned here in Australia, because I'm sure 3 years ago in America, people thought that would never happen to us. They would never cut national funding. And we're sitting here in Australia probably thinking, for many, this would never happen to us. They'd never cut this funding. But we just simply don't know. We are in an unprecedented time in our kind of socio-political climate, and we've made incredible progress. But progress can be easily undone by people with immense amounts of power.
Sarah, was there anything you'd like to add from your perspective?
James answered that so well. But I think in terms of things like HIV prevention and access to treatment, cutting funding, and the US provides so much funding and support for countries overseas and for research that's being done. Cutting that funding can really limit access for people who need access to HIV treatment and prevention, particularly in lower income countries. And I know that there are some services that have had to shut their doors in some places because they've lost that funding. And that's really impacting people because they might be in locations where this service is a form of safety for them to access support and care and their medications. So taking that away from people not only limits their access, but it limits their ability to access a safe service. So it's really important, when we're thinking about those marginalized communities, how cutting funding for something like that really impacts people within these communities. And in Australia, we are very lucky that, we've got such great access that's maintained here. But we do need to think about what that does look like, in terms of just globally, but also within Australia, accessing services for those people who do need it and who are coming from marginalised communities.
I want to now get you to both think about what advice you would give to people listening out there who want to become researchers. So it could be young people, could be older people who think, I really want to get involved in research and who want to focus on, it could be First Nations health, it could be aging health, could be LGBTIQ health and well-being.
My first two bits of advice that I would give is the first bit to understand that anyone can be a researcher. We have a very westernized, very colonized conceptualization of who a researcher is, that they belong to a university, that they have a PhD or some kind of qualification. But we know that for thousands and thousands of years, people have been asking questions without any type of qualification. So that's just important to remember, that a title, a job doesn't make you a researcher. The second you start asking questions and thinking critically about the things around you, in my eyes, that makes you a researcher. The second thing that I would add is for people who are researching communities they belong to, it's really important that you've had a deep interrogation into who you are before you do this. I found, like, my PhD explored, mental health within LGBTQIA plus communities, and it was, the most amazing project in the world. But Ricky, the amount of times that it ripped my soul out because of my own demons I had inside of me, that, harms caused by people within my community, broader societal triggers that kind of came up for me. And it's perhaps the biggest learning I've done during that time of my life, is how to respond to that and learning how I sit within the community. And I don't say that to turn anyone off away from community research. It's the most healing and fulfilling thing that you can do. But if you're not prepared to hold a mirror up to yourself and ask some pretty tough questions before you go in, it might be worth waiting before starting that journey and understanding yourself a bit more, because working in community, you will be forced to reckon with all those parts of yourself.
Thank you for those words of wisdom. Sarah, would you like to add your perspective?
Yeah, I'll expand on both those points that James made actually. So, in terms of who is a researcher, James is absolutely right. It is not somebody who, has a PhD who is at a university. Some of the strongest research that we're able to do really comes by engaging with people within community. So, those people who are community members, who are people who are accessing medications, people from organizations, medical doctors and researchers all working together to really make sure that the research is not only understood from all aspects, but also really grounded in the voices of the communities that we're trying to serve and we're trying to do this research with. So it's really important to have the diversity of people within research, and there are different ways that you can sort of be a researcher, as James said. In terms of James's second point about somebody who's within the community that they're researching, I sit on the other side of that as somebody who's outside of a lot of the communities that I'm researching. And so for me, I had to make sure that my engagement with people within community was really strong and that I maintained really open communication with sort of those organizations to make sure that all of the data and all of the data collection tools, the interview questions, were really targeted towards those people that we were speaking to. And it was all, had this multiple involvement of people to ensure that as an outsider, we had the involvement of people within the community as well. So I think you really need to think about the people that you need involved in the research that you want to do. And like James said, you start asking those questions and you're already inquisitive, you're already being a researcher. And then just, reaching out to, universities or organizations about how you can get involved in research.
Sarah and James, it's been an incredible honour to have both of you appear on our show and tell us a real detailed understanding and guide us to some of the research that you're both undertaking. And it was so interesting for us to hear perspectives of both somebody who is an ally working on outer groups and someone who is part of a community working in groups. Both of you have provided us an understanding and appreciation of the value and importance of research in Australia. And thank you so much for sharing your words of wisdom with us on our episode for Quest by Community, Our Health Matters.
Thank you for having us.
Thank you so much. It's such a pleasure.
Remember, we are all health consumers. We all have a role to play in our health equity journey.